Hi everyone, welcome to the Autoimmune Dietitian YouTube channel. My name's Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. In my work with my clients, I help them use both food and lifestyle as a very effective tool to improve their symptoms and hopefully get them feeling normal again. So one of my biggest concerns when working with autoimmune clients is nutrient deficiencies. Nutrient deficiencies are quite common in my client population, and this is because chronic inflammation can more easily deplete vitamin and mineral stores, which can ultimately put a strain on the immune system. So today we're going to discuss this phenomenon as well as highlight a few key nutrients to be on the lookout for, plus what you can do to uncover and reverse nutrient deficiencies. Before I jump in, I just need to attach my usual disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. Please consult your qualified health professional for any changes you make to your medical care. I apologize, there were some camera issues and we're back. All right, so why do nutrient deficiencies happen in autoimmune diseases? Well, they happen when your body doesn't have enough specific vitamins or minerals to support ongoing needs in the body. And in case you weren't aware, vitamins and minerals are used for energy production, to build and repair tissues, and to regulate reactions and processes in the body. And there are a number of reasons why nutrient deficiencies are more common in autoimmune diseases. First, inflammation in the digestive tract can impair nutrient absorption. Any gut-related autoimmune disease or anyone with food sensitivities, leaky gut, or dysbiosis, which to be honest is most people, will have inflammation in their gut. And food is how we get most of our nutrients. So having suboptimal digestion and absorption prevents nutrients from getting into our body to support our body's stores. Second, chronic inflammation can affect nutrient absorption. Inflammation can affect how nutrients are transported into cells, and they make that process less efficient. So inflammation may also contribute to malabsorption issues. And then lastly, stress can also lower nutrient absorption. Cortisol, which is your stress hormone, can slow down digestion and interfere with absorption. Stress also increases your body's demand for nutrients. And most people that have and live with a chronic disease tend to be stressed and have some stress in their life. So that is why I mention it, because it is very common among my population of clients as well. Okay, so there are several nutrient deficiencies that are commonly found in people with autoimmune diseases, and here are a few of these and why. Vitamin D. Vitamin D is the vitamin deficiency I see the most in my client population. This vitamin plays a vital role in the immune system regulation and inflammation. In fact, some researchers believe that low vitamin D may be an underlying cause of some autoimmune diseases. And vitamin D status is indirectly correlated to disease activity. So the lower your vitamin D, the more active your disease is. Iron. Iron is another common deficiency due to malabsorption and chronic inflammation. Iron helps red blood cells carry oxygen throughout the body, and this mineral also supports the immune system and helps with the production of certain hormones. Low iron may cause fatigue, it can impair endurance and muscle performance, and it can increase the risk of infections. Vitamin B12 is best known for its role in energy metabolism, red blood cell formation, DNA synthesis, and nerve function. Vitamin B12 is also a common nutrient deficiency because gastrointestinal absorption might be impaired, especially if there is inflammation present in the digestive tract. Vitamin B12 is also involved in methylation, which is a reaction that involves moving methyl groups from one carbon chain to another in order for reactions to happen. Many people with autoimmune diseases have mutations in their DNA that slow down methylation reactions, and this could also lead to lower vitamin B12 levels. Lastly, zinc. Zinc is a very important mineral that supports the immune system and is a potent antioxidant to combat inflammation. Low zinc levels are associated with an increased risk in developing autoimmune diseases and may exacerbate ongoing autoimmune diseases. So, how do you know if you have a nutrient deficiency? Well, here's a few ways you can kind of start to investigate this. First, you could look for signs and symptoms that correlate to specific deficiencies. Usually, your vitamin stores and mineral stores have to be pretty low in order for symptoms to occur, but this is a very obvious and good place to start. The second way you can start investigating your nutrient deficiencies is to get tested. I always recommend getting your nutrients tested. Many of them can be ordered through your doctor and be covered by insurance. Vitamin D and a full iron panel are the ones that I always recommend getting. B12, folate, homocysteine, those three combined are also good indicators to uncover any methylation issues. You can also do a full micronutrient panel with a functional lab. These tests can tell you what your levels are both in and outside of cells. Some people may have normal levels but could have issues with absorption, so that's why it's important to make that distinction. These tests are expensive, and it is a blood draw, so it's probably kind of the least most available option, but it is an option if people are really interested in looking at that. All right, so if you have an existing nutrient deficiency, how do you reverse that? So supplements are always recommended, as food will likely not be enough to replenish your body's stores. It's obviously super important to eat a nutrient-dense diet, and that should be happening at baseline, but taking high-quality supplements is really the best way to reverse a deficiency. Gut healing is also critical at this stage to make sure you are actually absorbing your supplements. So it's not just taking the supplements, it is working on your full diet and also making sure that you are supporting your gut health with lots of good nutrition and then also possibly additional supplements. Once you start a supplement regimen, it is also really important to retest your vitamin and mineral levels to make sure that you are actually absorbing your nutrients. You especially want to do this with anything that's a fat-soluble vitamin like vitamin D, because if you over supplement, you are at risk for toxicity because those tend to be stored in your fat cells and your body doesn't excrete them as quickly as water-soluble vitamins. All right, so just to recap, today we focused on nutrient deficiencies, what they are, the main ones that I see in my kind of autoimmune clients, and then how you reverse those. If you would like more help managing your autoimmune disease or want to kind of start digging into these tests or doing some more investigative work on just your overall nutritional status, I would love to help you. I offer free 15-minute discovery calls. You can find that link in my YouTube profile. My website is also there that has lots of great information. I have some free downloadable guides. I have a very extensive blog. You can also check out my whole library of videos to find a topic that you are looking for and interested in. If there's anything that you don't see, please shoot me a message. I'm happy to post a video about anything that you are curious about learning about. Lastly, if you do not subscribe to my YouTube channel, please hit the little subscribe button. I do try to put these out about every week. Always just trying to give you information to live better with your autoimmune disease and help you use food and lifestyle as a way to improve your symptoms. So thank you for joining me, and I will see you next time.